most recent report. And so we will continue to monitor that closely. I know there's a lot of chatter and discussion about that right now. And so we are, there's a lot to learn, I think. I know our partners at the CDC, state, and otherwise are monitoring that situation very closely. And we're watching what's happening in other countries. But I think it's clear at this time that there's no real indication that we should be concerned at this time. We'll keep monitoring and keep folks up to date as we learn more. Quickly to switch to talk about testing for a second. As you all know, we've worked to set up a number of testing sites in the community over the last couple of weeks. I want to say a huge shout out to our community testing partners who have been working very diligently to help get staff on board, to help secure space, supplies, and all the necessary tools to be able to operate testing sites. We are really encouraged to see those sites up and running and hope that it's helping folks in our community, but also taking some of the strain off of of the overall system. So I want to say thanks to our partners at StarMed and Mako Medical and other places who are helping us be able to make those testing sites available. We have noticed in the last 48 to 72 hours, we have seen a pretty significant drop in the demand for testing in Mecklenburg County. Many of our sites, if you go to them today, you can see you can probably get in and out in just about 10 or 15 minutes with little to no wait. So certainly that is good, but we want to continue to discourage people from using our emergency departments and the hospital resources for COVID testing. We do have plenty of space at sites across the county where people can get tested, and they should use those options and avoid the emergency department. As I already alluded to, our hospitals are under pretty significant strain right now. We are anticipating, we're expecting another shipment of rapid at-home tests on Monday. Unfortunately, we did get a shipping delay notification for those. We are expecting those to arrive before Friday. We heard from the vendor earlier today that they are en route somewhere between here and Connecticut. So we have went ahead and made plans to do another mass distribution this Saturday. We will be sending out a press release about that distribution later within the next 24 hours. To provide some details to the community about how they'll be able to access those tests. We are also going to distribute medical grade masks as similar to the last time as well. If you recall, last time we kind of went east and west of the county. We are going to go north and south this time. So we will have two sites set up on Saturday, starting at 10 o'clock in the morning. The first site will be at North Meck High School, which is at 11201 Old Statesville Road in Huntersville. And the second site will be at the Harper campus of CPCC at 315 West Hebron Street. Again, that's in Charlotte. So we will be starting that on Saturday morning at 10 o'clock, and we'll be going until 1 p.m. Again, we expect to have, ample supply of rapid test kits as well as masks, so there's no reason for people to arrive early. We really hope, again, we'll have a smooth process that folks can get in and out pretty quickly. And we will be using a similar approach that we did the last time in terms of 4 test kits per car, as well as a packet of masks for each household to take with them. At this time, I will come back at the end, but I'll turn it over to Dr. Fletcher to give an update from Novant, and then Dr. Hunter to give an update from Atrium.
Hey, good afternoon, everybody. This is Sid Fletcher with Novant Health. Thanks, Dr. Washington. I appreciate that. And I think a lot of the things that I'm going to say are really follow what Dr. Washington has said is going on for the county. So our hospitalizations, we think, peaked about 10 days or 12 days ago. So we've seen a very sort of slow drop over that period of time. And I think our models show that over the next 1 to 2 weeks, we expect a pretty precipitous decline, which is really, really great news. I would say that the testing demand has gone down quite a bit, just like Dr. Washington has mentioned. And we've seen our positivity rate right now of the people that we're testing is kind of mid-30s. So we're a long way away from that 5%. It has dropped some, but it's still higher than it's ever been at any point in the pandemic previous to this latest wave of Omicron. So I just tell you, there's a lot out there. We also noted that over 93% of the people that are hospitalized currently are either unvaccinated or undervaccinated. Just again, some of the repeat messaging that you've heard us say around that. In terms of variants, we mentioned BA2. Yeah, there's always going to be a new variant. One of the things that I think is important to reiterate is that we've seen that the vaccines are really great at what they do: prevention of hospitalization, prevention of death, with every variant that we've seen so far. But when you read it, you read out there, hey, there's a race because there's going to be a new variant. That's because we really want to reduce the number of hosts, those that are unvaccinated, that are in the communities, because that's what viruses do. They replicate, and when they replicate, they make mistakes, and that's the variants that you see. So know that there will be more variants. The more people that are vaccinated, the better we're going to do against this. Those are my main remarks, and I appreciate it. I'll turn it over to Dr. Hunter.
Great. Thank you very much, Dr. Washington. Thanks for having us here, and the county for having this opportunity. And really, I'd also like to thank the media, because you're partnering with us to push out our important messages. Some of them may sound like a broken record, but it's the vaccinations. It's get your vaccinations, get your booster when eligible, and we need you to keep telling those stories. Well over 90% of our patients who are on life support are unvaccinated right now. So that's just another sign of how these federally approved, safe and effective vaccinations are doing what they're designed to do. So a little bit of hope that we're seeing these positive cases declining. The hospitalizations is always the last number to start going down. And although we've seen slowing of our case increases, we are not seeing any declines at this time. And so from the hospital's perspective, we are nowhere out of this pandemic. And I think as the community looks at those positive signs of decreasing cases, we need them to know that your healthcare workers are still in this battle knee deep, trying to get through. So we need you to keep doing the things that keep us all safe, that help us help you. And if you have a chance to see one of those healthcare workers, please show them some appreciation. Please thank them. We've all been at this a very long time. So that's where we would like the community's help with this. And lastly, of course, please get vaccinated. Please get boosted when eligible. This is our way out of the pandemic. So I'll stop there and turn it back to you, Dr. Washington.
Thank you guys so much. Two more quick comments before I open up the floor for questions. The first of those is I do want to just remark, I've got a couple of questions over the last week about case investigation and contact tracing. We have officially stopped our case investigation and contact tracing for the general public. That was following official guidance from the North Carolina State Department of Health and Human Services, where, again, as we're transitioning to really a new phase of surveillance for this pandemic. And so we will not be doing the general contact tracing and case investigation for the general public. We still will be doing contact tracing and case investigation, obviously, for high-risk settings like our congregate living settings, long-term care facilities, the detention center, shelters, residence halls on campuses, classrooms and schools. Those settings we will still be following up, but the general public contact tracing and case investigation will not be happening any longer. I do suspect at some point in the near future, we probably will see a similar pattern across the country, but we've gone ahead and taken that step here to be most efficient with all of our resources. And let me just finally close with where we always start, and the broken record that we continue to sort of spin. Please do the things that we all can do to help us get through this surge and through the next one and the one after that. And those basic things are: one, get vaccinated. We know the vaccines work. We have well over 70 outbreaks in long-term care facilities right now. And a year and a half ago, that we had a similar number of outbreaks, and folks were dying every day in those facilities. And that's not happening right now. And so I think that, in addition to what our hospitals have reported about who's in the hospital and their vaccination status, all underscore and really demonstrate the effectiveness of these vaccines to keep people alive, keep people healthy, and keep them out of the hospital. And so we have to continue to drive home that message. And that message is not going to go away anytime soon. COVID's with us, and that's going to be an essential piece of our response as a community. And certainly we have to continue to do that. Lastly, I'll reiterate those other things that we know are helpful. Obviously, good mask behavior. So when you're out in public, wear a mask, preferably a medical grade mask. We will be making those available to the community as much as possible. And of course, you can always continue to practice good hand hygiene and just take care of yourself, your health in general, how you eat, how you live, all important things to keep you as strong as possible when you impact or come into contact with COVID or anything else. So with that, I'll open up the floor for questions.
First question today is Joe Bruno, WSOC TV.
Hey, y'all. I'm curious, what do you think is the reason behind the sudden drop in demand for COVID testing? I was out at StarMed's West Charlotte location, and I also popped by the Mako at Bojangles and the Atrium on Beam Road. And I think there were 5 people combined between the 3 sites when I was there between 12 and 12:45. Huge difference between just last week alone. Why do you think that is?
Yeah, Joe, I think there are a number of factors that are obviously contributing to the drop-off in demand. Obviously, a large number, more people than ever, have had COVID in our community over the last 6 weeks. And it is the virus spreads very quickly, but it also, most people recover pretty quickly. And so I think we're seeing some of the impact of a lot of people have gotten COVID and we're starting to have this trail off. And so the need is naturally going to start to taper off. Secondly, obviously, we have set up additional sites, and so we're spreading people out further in the community to be able to get testing at more additional sites. Our healthcare partners have done that at their urgent cares and their testing sites, as well as those community testing sites I talked about earlier. And then also, rapid test kits are getting back on shelves in stores and Amazon and Walmart and Walgreens. And we know people in the community are taking advantage of those and purchasing those to use. This federal rule that made these reimbursable healthcare costs certainly makes it more accessible for those in our community who have health insurance and are able to purchase them. So I think it's really a combination of factors that's led to the drop off in demand. And we are obviously, as we are seeing some encouraging signs that the peak is behind us, it's expected that demand would taper off as well.
Next question, Chloe Leschner, WCNC.
Hi, thanks so much. I'm not sure if I missed the memo from the state that contact tracing was ending, but I guess can you explain a little bit more about why that was a choice that was made and how that enables you to use resources in different ways? Thank you.
Sure, Chloe. So this was guidance to local health directors and health departments across the state. I'm not sure if there is a public document that's available, but certainly we have taken that guidance and devised a plan for implementation here locally. We certainly recognize with the high level of community transmission and the fact that COVID is again with us and going to be with us, that the idea of utilizing contact tracing and case investigation as a primary methods of containment simply are not suitable or feasible for the long term. And so it's time in this pandemic that we make that shift. Again, as we look to better manage how we respond to COVID. And again, we've learned so much about the virus, our communities learned so much. And so things are transitioning in that way.
Next question, Lindsay Klein, Fox 46.
So I just wanted to clarify, you guys had mentioned that there are newer variants. I want to make that clear. So besides Omicron, you guys are seeing a newer variant since we've seen Omicron in some of the testing?
Sure. To be clear, I wanted to address that because I know there's been a lot of national news about the BA.2 variation of the Omicron variant. And so there's been a lot of discussion about it. It's obviously been detected in several states and other countries as well. There had been some speculation about it potentially being more transmissible or being very different from the original version of the Omicron variant. There's no evidence that that is the case at this time. There's also some what I would probably call misinformation that that variant cannot be detected on PCR test or rapid antigen test, and that's not true. So I just wanted to make sure that everyone's clear that as you see news about or people in the community are talking about the BA.2, which is a variation of the Omicron variant, it's still the Omicron variant mostly with a slight variation, that is at this time not of concern for us in the community.
Next question is Jay Donaldson, BNC.
Good afternoon. This is Janine from Black News Channel. I am sorry if I missed this in the beginning, but I wanted to know about the current hospital capacity here in Charlotte. And I know that FEMA was called in to help with the hospitals. In what capacity will they be assisting?
I'll take that one. So we're currently running above 95% capacity at our hospitals. Working with the governor and with the state, we put in a request for any FEMA assistance that might be available. That is in the process, so we do not know if we will receive any assistance at all, and if so, what assistance that might be. So I think that is still to be determined, and we are waiting to get a decision.
Next question is Eric Spanberg, Charlotte Business Journal.
Yes, Dr. Washington, I'm curious if let's assume that things go well, we see significant declines, and people start to think about what they can do, how things can be a little bit more open. I'm curious from a work standpoint, a traditional office setting, what advice would you give employers in terms of trying to figure out when to bring people back to the office or when to have people in offices more often? And then secondly, what are you advising for retail outlets where obviously they have people in and out all the time?
Sure. So, our guidance to businesses is no different than our guidance to ourselves, really. I think as we recognize fully that COVID is here, it's going to be with us. It's important for all of us as organizations to adopt and adapt the tools and guidelines that we know are helpful in allowing us to be able to manage through surges of COVID now and in the future. And it's important for us to do that. And so I think, no different than what the county's doing, businesses obviously should offer flexibility to employees as needed if they have COVID infections. You don't want to, you want to make it easy as possible for people to adhere to isolation guidance. There are a number of measures that can be taken to de-densify or to reduce the risk of spread in offices. But I think, again, it's going to happen in waves, right? So when we have high levels of community transmission, businesses will need to adopt or adjust their practices during those periods of transmission to be able to be as responsive to the needs of their organization. And it's different for every organization. So I certainly think if you implement tools like vaccine incentives or vaccine requirements are helpful to ensure your workforce is protected. Also making sure that you have systems in place to monitor when your workforce has been impacted by COVID-19. But I do think that, at this time, we're not advising businesses to not bring people to the office. They certainly, I think it's possible to do and can be done. It's just a matter of preparation and using the tools that we have at our disposal, including mask wearing, environmental controls, and building in just ways to manage given that COVID's here.
Thank you.
Chloe Leshner, you're next.
Thanks again, Dr. Washington. You have mentioned a few times kind of COVID being with us and this transition, and that we possibly have hit the peak of this surge that we're in now. What do you think the chances are that we can kind of move into that endemic phase, and what could come next once we kind of get through the Omicron surge?
Sure. Again, I always tell you guys I don't have a crystal ball, and I don't. But I think we all, most of us in the public health epidemiologists, we really think that transition is occurring. But of course, it's a virus, and as Dr. Hunter alluded to earlier, it's going to mutate, and every time it spreads from one host to the next, and every time it starts replicating, that's an opportunity for it to make a mistake and to become a new variant that has some new behavior or some new consequence for how it affects or impacts people. COVID-19 as a virus is really, really big and really volatile and makes a lot of mistakes. And so I think it's difficult to exactly predict, at what point, we are living with COVID in a way that's not so much impacting our everyday life. But I do think we're on the right pathway to that. But we definitely need folks to get vaccinated. I mean, that is the thing that avoids the strain that we're seeing right now in the hospital. As you've heard them say, that their sickest patients, the ones that are requiring the most care and most resources, are those that have yet to be vaccinated or not up to date on their vaccines. And so that's what protects our healthcare system. And of course, it protects life. It keeps people alive and keeps them well and avoids the likelihood that people have long haul or long-term symptoms related to the virus. So that really is the key, I think, and really continuing to push that message is the central message here, is that we need folks to get vaccinated.
Next question, Claire Donnelly, WFAE.
Hi there. Thanks for taking my question and thanks so much for doing this. Sorry, I'm a little bit late joining. I was having some technical problems. I wanted to ask, at the state level, we're still seeing the hospitalizations going up. Is Charlotte just ahead of the curve on that? And I know Novant also, you have some locations in the Triangle. Are the metros just ahead of the rest of the state there?
Sure. So I'll speak the collective measure. So looking at all the acute care facilities in Mecklenburg County, we are starting to see some stabilization in our admissions for new patients in the hospital, as well as a number of active patients in the hospital. As Dr. Hunter mentioned, that varies by facility. And it also varies a little bit by sort of some of the market dynamics. I am aware that there are that hospitals in the regions around us, as well as to the south of us in South Carolina, are also experiencing pretty significant strain. And many of those facilities are also going on diversion at times, which therefore impacts our facilities in Mecklenburg County, our emergency departments as well as our emergency response, our EMS teams, because it impacts turnover times. And so the systems are all working together to be able to try to help manage through that. But certainly that is creating additional strain here in Mecklenburg. But to answer your question about our trends here, we are seeing some stabilization overall across all the acute care facilities. But again, that varies by facility.
Yeah, this is Sid Fletcher at Novant Health. I would just tell you that, again, we've seen stabilization, no prompt drop off, and record high hospitalizations within the state. Well, now that we're starting to see the testing number go down, and just remember, in that testing number, we're not including home tests or other things like that may be part of it. But as we've seen that very recalcitrant number start to dwindle a little bit, the expectation is that the hospitalizations will reduce behind that number reducing, right? There's a lag that's sort of built into that. And across the country and across the globe, we've seen some fairly precipitous drop-offs, and I think that we're modeling and hoping that that's going to be the case. But I think we're ready for whatever may occur, and we're handling it with our current capacity.
And at Atrium Health, we're certainly optimistic with this decrease in total cases, but we are not out of the woods on this. And so we have a slowing increase in cases. So I think stabilization is accurate, but we expect, because it's been the behavior with every other surge, that hospitalizations lag for a week or 10 days or even 2 weeks behind that peak of cases. So we're not out of this yet. And that's the message I really think the community needs to hear, that we are not out of it yet. Our healthcare workers are in it deeply, and we still need your help doing all those things that Dr. Washington mentioned to try to decrease the impact, so that we will be here to serve you in all the other ways that we're here to serve you.
Yeah, just to echo Dr. Hunter's comments about the other ways that hospitals are serving our community, our healthcare systems are huge assets for this region, and do a lot more than just emergency department care, and a lot more than than inpatient care. I mean, they have acute care, they have urgent care facilities, primary care facilities, and when we put the systems in strain, we take from those other systems, and people can't access things like primary care visits, or they can't access the hospital for other things that are urgent. So we really have got to focus on protecting those resources and making sure that we're doing, as community members, we're doing everything possible to take some of that strain and stress off of them. Their workforce is tired. I know for sure they're tired. Our teams are tired. We've been at this for 2 years. And so it's really important that I think everybody, as you guys are reporting to the community, that it's clear that this is taking a toll on folks, and we really need people to do their part. And it's not a lot, to ask folks to wear a mask, to avoid large gatherings, and to get vaccinated so that we can, again, all move forward in life and with COVID here with us.
Next question, we're going to circle back to Jay Donaldson at BNC.
Hey, so I know we were just talking about the hospital. I can't get the word out of my head, but how many people, the hospital capacity, sorry. So I know you said the 95% capacity, that is not just our community, but across the state, right? And I know also that, yes, you reached out to FEMA and you're not sure what kind of help they could send, but what kind of help is needed in the hospitals here? And as you're working to keep taking inpatients, what kind of mitigation efforts are you doing to increase capacity and increase staffing to help with COVID patients?
Sure. So this is Jim Hunter with Atrium. So certainly we're above 95%. Our staff has been at this, as mentioned, for over 2 years. There's a staffing shortage across all of healthcare across the United States. So we've been dealing with this in a number of ways. It's pretty well known that we rescheduled some well visits that are out there. We've redeployed some of our staff. We've brought in what we call a runner program into our hospital, so non-clinical people can work with the clinical people. We've rescheduled some non-time urgent operations and procedures. We've even redeployed and closed some specialty centers. So we're pulling the multiple levers that we learned over the last 2 years on how to create capacity and to make sure that we have the doctors and the nurses and all the staff needed to take care of you for both COVID and all those other things. So we're really using all the lessons that we've learned over the past 2 years.
Yeah, similar at Novant Health, we've been able to bring, some other people back to the bedside where they could be helping hands and really help support our teams in that fashion. I would say it's not entirely unusual for the hospitals to be really busy during the winter with non-COVID related things. That's not unusual. What's a little challenging in this situation is, to Dr. Hunter's earlier point, there's a reduced number of people in the workforce, and then our workers are just like everybody else. They're moms and dads, and they're out, they're community members. Some of them have contracted illnesses and have been out as well, which does affect, how things go. And again, we've been managing at around the 95% capacity as well during, especially the last few weeks here. And we're hoping that as things turn, we've kind of weathered that storm, but we have utilized a lot of the things that we learned within the other surges. Everyone has its own nuance to it. Each surge has had a little bit different flavor to it, but we've been able to navigate that by using all the things that we've learned previously.
Just what kind of help were you hoping for from FEMA?
There's multiple options that they have, and there's not a standard deployment from FEMA. But we've proven that we can use clinical people as we've redeployed our clinical people. We've proven that non-clinical people can play an important role by being runners and assisting in non-clinical. And so at this point, with the opportunity of just more personnel, we'll be able to deploy them in a way that will give some assistance to our already overworked and tired staff.
Hey, this is Katie Soloff with Axios. I wanted to follow up about the need for FEMA personnel to assist in the hospitals. One, how long do you anticipate that this need will be there? And two, does this underscore a larger problem with any of Atrium's hospitals in that there could be trouble retaining nurses and other emergency personnel at such a dire time for the hospital?
Sure. FEMA makes a decision of how long they're going to deploy people. Atrium, along with every other health system in the United States, has been working with a relative staff shortage now for many, many months. So we are no different, no worse positioned than anyone else. In fact, I would argue that we're a lot better because we've learned so many lessons and we've got the volume of people in the greater Charlotte region that we can deploy and move around. The request for FEMA is because there was the ability to request help. And we're certainly committed that any help and anything we can do to make it easier for our teammates, we're going to do that. And it's been this way in Charlotte. Community has been fantastic with this the whole time. So Mecklenburg County has helped Atrium, and we've helped Mecklenburg County as we've gone through this. We've worked with the state has worked with us, so we've helped each other. We gave out over 2 million masks. It's been mutual help going on. And so working with other health systems and all the other both public and private providers, we've all been helping each other and pulling together as a community. Our community has helped us through the thanks they've given our healthcare workers, and we've done a lot for our community and kept things open and going the whole time. So I think this is a natural where there was an opportunity to ask for additional help, and if we can get additional help for our patients and our teammates, we're going to ask for it. I would not interpret it much broader than that.
Floor is open for follow-up questions. Any further questions today?
I do have a follow-up, a question. I
ahead.
know that the State Department of Health has also sent out information just about equity in healthcare and how the Omicron variant cases of COVID-19 among Black people were down in December, but with the Omicron variant, those numbers shot up, and they're also the highest population taking up space in hospitals with COVID. So is there any specific push in communities of color to try to get them vaccinated? Are there any plans in place to have more vaccine events? What are we doing to reach those communities that are still hesitant to get the vaccine?
Sure. So thanks for the question. So certainly we are seeing some evidence that the African American community is we're being hit harder. That unfortunately is not terribly surprising given, as you alluded to, the vaccination rates among the Black community here in Mecklenburg County and across the state continue to lag behind every other racial ethnic group. Certainly we at the department, our COVID response unit has a pretty broad reaching outreach effort, a series of or compilation of outreach efforts to reach out to not just the Black community, but anyone who is experiencing vaccine hesitancy or have concerns about vaccines or questions. We have boots on the ground, both health department employees as well as our community partners who we're supporting to knock on doors, answer questions. They're in barbershops, beauty salons, at faith-based organizations, as well as recreation centers, everywhere we can reach people to have those one-on-one discussions. We are having a series of, we continue to host community-based vaccination clinics. These are happening across the county. We are targeting those in areas where where vaccination rates are lower, as small as a census tract. We're tracking that data in the health department to be able to help focus those efforts. We actually have a vaccine event this weekend with the Kappa Alpha Psi fraternity at their house. We're doing education. We'll have outreach teams as well as vaccines on hand if folks want to get one. We are still doing our Doses to Doors program for people who can't come out or don't want to come out. And so that is available. And we have a whole network of community partners doing outreach and education in a lot of different settings. We have a number of community health workers that are in community-based organizations that are helping as well. So we're all hands on deck and continue to do that. I will acknowledge, though, that it's difficult and happening very slowly. Many of these conversations take multiple discussions. It's not just a one touch. It's really multiple touches and really in many ways having to walk people through their fears, their anxieties, their questions, their concerns to ultimately get them to the point of getting a vaccine. And so we continue that work and welcome any suggestions or partners who want to join in that fight with us.
I can also say that at Atrium Health, we had the whole Community Immunity for All program that we've had now for almost a year. So we've been doing mobile vaccinations, mobile testing. We've gone into faith faith communities and done that, and that has continued for almost a year, multiple times a week. And if you want more details, I'm sure that I could hook you up with some of our folks here to give you more of the details and specifics on how many events we've had. But it's been every week for a very long time. We've been reaching out into these historically underserved areas. So happy to get you more information offline.
Yeah, this is it. I would also say it's been a great partnership between both healthcare systems and Mecklenburg County Health Department, and just try to figure out where we could put sites. We've done mobile as well. A lot of this is working with those trusted resources within those areas. So Dr. Washington mentioned the community health workers. That's a huge one. Working with the faith-based community, another really important one, where you want people talking to those that live in that community and that are known trusted entities as we try to walk through this, because it's been out there about vaccines for a while. There's obviously some resistance to doing that, so we're trying to use everything that we can, I think, to try to overcome that. And it's super important to try to get that out into especially some of these historically underserved communities. And I think we've been working hard at that since the beginning of the pandemic, and there's more work to do.
Okay, floor is open for follow-up questions. Any further questions today? But thank you, Dr. Washington, Dr. Hunter, and Dr. Fletcher. Everybody have a great afternoon.
Thanks, everybody.